Thank you for joining us for this MD Magazine peer exchange. Postoperative ileus is among the most common complications that can occur following gastrointestinal surgery or cystectomy. The more severe cases can result in prolonged hospital stays and dramatically impact patient quality of life. Enhanced recovery programs, or ERAS, were developed to help reduce mortality and morbidity, but protocols are not implemented consistently across many institutions in the United States. We have assembled a multidisciplinary panel of experts who are here today to discuss the benefits with and barriers to adhering to this multimodal approach. I am Raoul Concepcion, and I'm the director of the Comprehensive Prostate Center in Nashville, Tennessee. Joining me for today's discussion are Dr. Sanjay Patel, Assistant Professor for the Department of Urology at the University of Oklahoma Health Science Center in Oklahoma City, Oklahoma, Dr. John Dalton, Chief Quality Officer of PhyMed Healthcare Group in Nashville, Tennessee, Dr. Traci Hedrick, Associate Professor of Surgery, Co-Director of the Enhanced Recovery After Surgery Program, and co-lead of the Digestive Health Service Line at the University of Virginia Health System in Charlottesville, Virginia, and Dr. Declan Fleming, Chief of Surgical Oncology in the Department of Surgery and Perioperative Care at Dell Medical School, the University of Texas at Austin. Thank you for joining us today, and let's begin. So as we get started here, I think we all recognize, knowing that we have representation from a number of different surgical subspecialties and obviously anesthesia, that a lot of things that we've done preoperatively, perioperatively, postoperatively have been really based upon a lot of anecdotal evidence, a lot of personal experience. But I think as we move into this post-macro world, this transition from volume to value-based medicine and standardization and looking at metrics, outcomes, standardization, I think something like this enhanced recovery program becomes very, very critical. So Declan, you're involved in basically the creation of a new medical school, congratulations, and the opportunity to really sort of move forward with operationalizing an enhanced recovery program. So tell us a little bit more about what's your definition and how do we, as institutions and as individuals, want to adopt this and adapt it. Tell us what's involved.
All right. Well, it is a process. Enhanced recovery has to, by definition, include not only the surgeon and the anesthesiologist, but really it involves everyone in the hospital. It involves the patient and the patient's family, because at any point in time during the recovery of a patient following surgery, if we're not on the same page, if we're not moving the same direction, it takes very little to derail a process. And what we've found is that really creating an understanding that this is a team project has been the way that we've become successful at implementing enhanced recovery protocols. There are so many opportunities to go in thinking that we're doing the right things, to go offline and to begin to fall back to these old patterns that we had used for so many years. As I started my training, everything that I did, taking care of patients following surgery, was basically things that my older mentors were telling me. And it was dogma. They told me what they had been told and what those before them had been told. And it really wasn't until the 90s when the introduction of laparoscopic surgery began to change people's ideas about how long should a person recover from an operation. And open surgeons, not wanting to be outdone by their laparoscopic colleagues, began to say, well, maybe I can let my patients go from the hospital a little bit quicker. Maybe we don't have to have a tube in everyone every time. And all of this has driven forward a different way of thinking about taking care of patients in their recovery from surgery.
So Traci, you've been very involved in this even from a national society, is that correct, in terms of looking at the development of guidelines and how surgeons and anesthesia, and again, this multimodality approach. Give us a little bit about your experience looking at this at a national level.
So when I go and talk, a lot of times the first question that I get asked is, what is it about enhanced recovery? And what one or two things can I adopt in my practice that can affect change? And really what we try to tell folks is that it involves creation of individual programs at each institution. There are basic tenets of enhanced recovery, so you want to limit opioids. That's probably the most important aspect of it. You want to limit the amount of intravenous fluids, and with that you allow patients to eat and drink right away. You want to involve patients in their care, and you want to encourage them to get up immediately after surgery. And there could be hundreds of different ways to do that. You want to choose a pathway that you have buy-in from all of the different care providers at each institution. And so nationally what we do is when we're creating guidelines is look at all the evidence and try to drill down onto what we think is the most important, what has been shown from high quality studies to be effective, and then produce guidelines that can provide as a guide.